The TuLip-i is a guide that directs a fiber optic bronchoscope to the larynx. The TuLip-i can facilitate bronchoscope insertion by pushing through obstructions of the oral cavity and pharynx. In combination with an anesthesia mask, the TuLip-i can also be used as an airway. Unlike ordinary oral airways, this device can deliver air closer to the laryngeal inlet. U-shaped flaps at the tip are guided into the piriform fossa upon insertion, so that the fiber optic groove is inserted in the median position relative to the trachea. The TuLip-i is only intended for use in adults. This one-size-fits-all device is comparable to laryngeal mask airway sizes 3 to 5. This product is intended for fiber optic bronchoscope intubation under general anesthesia. When using the device to intubate conscious patients, be sure to use adequate topical anesthesia, sedation, and a bite block. The TuLip-i should not be used for patients with a full stomach, patients at a risk of gastroesophageal reflux, or patients with hemorrhagic lesions in the oral cavity. The body of the TuLip-i is silicone. The design of the TuLip-i prevents obstruction of the mask inlet. Specially designed grooves serve as guides for fiber optic bronchoscopes, as well as airflow channels. A blue mark indicates the position of the fiber optic tip. The suction port can be used to remove saliva and water vapor, which can obscure the bronchoscopic view. The lifter lifts up the base of the tongue and epiglottis. The arch helps lift the bronchoscope and facilitates changing the direction of the bronchoscope during insertion. The thin and flexible flap tip can follow a narrow pharynx and capture the median position of the trachea. The introducer prevents bending of the flap tip during insertion. This product is unsterilized. Before use, sterilize the device using an autoclave, hydrogen peroxide plasma, or ethylene oxide gas. Remove the rubber band before use. Spray lubricant inside the flap and fiber optic groove. Use of a lubricant jelly may interfere with the bronchoscopic view. Connect the suction tube and start suction. Hold the middle of the TuLip-i with the introducer and insert the device so that the lifter slides over the tongue surface. When the tip reaches the proper position, you will feel a click and some resistance, similar to inserting a laryngeal mask airway. Remove the introducer while holding the TuLip-i steady. The correct position of the flaps can be checked by pushing in the handle. Remove the suction tube and mount the anesthesia mask. Ensure that the suction tube fits within the mask. Difficult mask ventilation may indicate that the tip of the TuLip-i may not have reached the larynx. If this occurs, push in the handle. Pulling up the tongue with gauze while pushing in the handle may also be effective. After the patient is sufficiently oxygenated, remove the mask. Prepare a tracheal tube over the fiber optic bronchoscope in advance. Use a bronchoscope with a maximum diameter of less than 5 millimeters. If the bronchoscope is too thick, it may get caught in the groove of the TuLip-i. Once you see the arch, The glottis may be visualized by directing the bronchoscope tip anteriorly. After the bronchoscope enters the trachea, remove the TuLip-i. Solutions for when the TuLip-i cannot be inserted smoothly. In case the epiglottis does not pass over the arch. If the epiglottis appears in front of the arch, push in the TuLip-i while pulling up the tongue with gauze. The epiglottis should pass over the arch with this technique. In the case the epiglottis is depressed into the groove. Try pulling the TuLip-i back a little because the epiglottis may be pushed up by the arch. If the glottis appears ahead of the arch tunnel, advance the bronchoscope into the trachea. Insert the tracheal tube after the TuLip-i has been removed. In case the tracheal tube will not advance. If you suspect that the end of the tracheal tube is hitting the arytenoid cartilage, turn the tube 90 degrees counterclockwise and try advancing it again. There are various techniques for preventing erroneous insertion of the tracheal tube under bronchoscopic guidance. For details, please check the technical operating procedures of your bronchoscope. Inflate the cuff. Connect the anesthesia circuit to the tracheal tube. This product is for single use only. Please use according to the included instructions.